Antenatal depression is depression that's occurring after a mother has become pregnant or found out that she's pregnant. Depression occurring at any time involves feeling very low in mood, but as well it can involve a number of other problems, such as feeling quite anxious. Mothers with antenatal depression will often report that they really are very worried about the baby that they're carrying, even though people are trying to reassure them that things are okay. They might have lots of anxieties that are really out of proportion. They might find it difficult to sleep, find that they lose appetite, their concentration is bad, find at times that they're very tearful. And at its very worst, mothers can sometimes think that they feel so low in mood that they wish they just didn't wake up the next morning to be free of the feelings. So it can be quite a severe illness. Pregnancy, of course, or finding out you're pregnant, finding out even for a father that you're going to be a parent, is going to bring a lot of changes and a lot of adjustment in your life. And mums are going to have a big responsibility. They've got to ensure that they carry the new baby all the way through to the time of delivery safely. They've got to look after themselves. They have a lot of hospital appointments. They have to explain to other people that they're a new mum, and for some people that can be a shock if they find out that they're pregnant out of the blue. It might be unexpected, and even for people who are trying for a new baby, suddenly it becomes very real that they have a lot of changes to make in their lives. And so people go through a lot of ups and downs, even though, as I say, we might expect it to be a happy time. The parents of the baby sometimes have to sort of renegotiate their relationship. They go from being boyfriend, girlfriend, husband and wife to now to being parents and everything that entails. So there are a lot of stresses and strains which probably give people, as I say, those good and bad days, but it's when women feel low and that low mood goes on day after day that we call it depression rather than normal sadness. It's thought to affect probably about 1 in 10 women, which is the same proportion of women who would have depression even when they're not pregnant. Depression is surprisingly common. But of course it's a big worry because the mum is now carrying a new baby. And of course if someone has antenatal depression and it's not treated, then it may well persist during delivery and it'll of course turn into postnatal depression. Depression isn't automatically cured by having a baby. The important thing is to enable people to talk about how they're feeling, because on the part of the mother, it's helping her to recognise that this low mood is out of proportion and that help is available. But if a doctor or a midwife or a health visitor meets someone with depression, it's, as I say, it's allowing them to talk, and particularly in a non-judgmental way. Women are often quite fearful about talking about how they're feeling. They worry that perhaps they're going mad, as people sometimes say to me, or that people will judge them in some way, or that they're a bad mother. So it's important to allow people to talk, and there is help available, either through talking therapies such as counselling, or sometimes for severe depression, antidepressant medication. Postnatal depression is a condition that actually turns out to be surprisingly common, affecting as many as 1 in 10 mums or more. And the main thing we think of with depression is feeling low and sad, but a lot of other problems go along with it, particularly when you bear in mind that mums are looking after a new baby. Mums often feel that they lack confidence in their ability to look after the baby. They might feel anxious about the baby's health, and this anxiety is out of proportion to what's going on. So if your health visitor, for example, reassures you as a new mum that your baby's fine, with postnatal depression, you'll often persist in having worries about the baby's health. You may find that you're tearful at times, even for no apparent reason. Well, of course, with a new baby, often you're woken up to feed in the night, and sleeping is a problem, but even if the baby's asleep, you might be tired and find you can't get off to sleep yourself. Antenatal and postnatal depression are both very similar in the way that mums are feeling. The main difference is that at one time a mother is pregnant and another time she has a new baby for whom she's responsible. And it may be that with postnatal depression a lot of mums' feelings are tied up with the new baby, might be concerned about the baby's health, for example. What's important to bear in mind is that if a mother has antenatal depression that isn't treated, then that will just continue during the time that she has the baby, and afterwards it'll just turn into postnatal depression. Having a baby isn't an automatic cure for depression, and that's why it's so important to tackle antenatal depression when it's spotted. Partners are very important. For mothers with postnatal depression, often they're reluctant to talk about the way they're feeling. They might be embarrassed to talk about it. They may just think that the way they're feeling is all part of being a new mum. So if you recognise that your partner is feeling particularly low and is particularly changed in their mood, then helping them to talk about it is important, and then helping them to seek help either through their midwife, health visitor, or the general practitioner.
Well, recognition of the disorder is the most important thing, really. Sometimes therapy can help, but a lot of women need antidepressant therapy. They need to take medication.
Well, the two main avenues of treatment are either with counselling or psychotherapy, or with antidepressant medication. People have often heard of some antidepressants like fluoxetine or Prozac, and they're the sort of drugs that can be helpful for depression in new mums.
But there is a risk of the same problem happening in a future pregnancy. So if a woman's had one episode of postnatal depression after one baby, she's at increased risk of having it in the next pregnancy, and that needs to be looked out for.
Well, postnatal depression affects not only the mum, and without treatment their depression can go on for as long as a year, but it's going to affect those people around her. So partners can be affected by the depression, and it can have a severe effect on the quality of the relationship. And of particular importance, it can have an effect on the developing child. And research has been shown that if mothers have postnatal depression which isn't treated, children can have problems in their own emotional development and their social development. And even now it's recognised that children of mothers who've had long-lasting postnatal depression have school problems. So it's problems that persist well into childhood. Baby blues is a condition that comes on after a mother has given birth, and it's something a lot of mums have heard of. It tends to come on about 3 to 5 days after the baby's been born, and it involves a lot of ups and downs in moods. Mothers often report mood swings. They're often quite irritable, they might have problems sleeping. To other people they might appear a bit confused, but it's a condition that passes, and usually after 10 days everything has cleared up.
Most women who have had a baby will get the blues on the 3rd or 4th day, where they feel very weepy and vulnerable and they can't cope with any sort of decision making. That's a perfectly normal process, and they'll recover from that very quickly. That blues feeling can last a bit longer in a small number of women, but usually will resolve spontaneously.
It's really hard to call it an illness because it affects probably over half of all mothers. In fact, it's almost normal in a way that mothers experience these mood swings. And really the thing is to be reassured that they will pass. We're not sure what causes it. It's tempting to think that baby blues is caused by the fall in hormones that mothers experience after a baby's born, but actually research so far has shown no difference in the hormone levels between mothers who experience baby blues and those that don't. Postnatal depression tends to be more severe in the low mood and the sadness that mothers get. It also comes on usually a little bit later than baby blues. Postnatal depression tends to come on about 4 to 6 weeks after the baby's born, whereas baby blues comes on within the first few days after delivery, and it's something that passes. Postnatal depression is something that persists without treatment.
True postnatal depression is a depressive illness. It's something that occurs to a woman after she's had a baby. It's often insidious in onset, so nobody really recognises it when it first starts, and manifests itself in many different ways. A woman may become withdrawn, she may not want to go out or see her friends, she has great anxiety about her capabilities of caring for her baby, she can't sleep, she can't eat. It takes the form of a true depressive illness and requires treatment. It's not something that will just go away. And if a woman feels that she has postnatal depression, or indeed her husband or her partner feel this is what's happening, they should seek help immediately from their general practitioner.
Well, there is some research now that shows that the number of men who suffer with postnatal depression is as common as the number of women who suffer with postnatal depression, up to about 1 in 10 dads. And as well, I think that signals that there are a lot of stresses on fathers as well, that they have a lot of responsibility with being a new father. They might have to think about where that baby is going to fit into their lives, and they're going to have to think about the relationship with their partner or their wife. So yes, there are a lot of strains on fathers. I think we tend to concentrate more on mothers because we tend to think of mothers as those people who give most care, almost one-to-one care to children. But in this day and age now, a lot of parents are taking equal responsibility, so I think we're going to have to pay more attention to postnatal depression in fathers as well. Parenthood is a time of big change. It's